Ebola has been with us for a very long time. They had it in the 60s. It was actually named after a river in the Congo. And it's a disease that is highly infectious.
Ebola spread throughout Sierra Leone. We had over 8,000 deaths during the period. Very little economic activity in the entire country for nearly 2 years. That led to a lot of poverty thereafter.
But health ministry officials in the state say they are investigating a Liberian man who is visiting the country and has shown symptoms of the virus.
We're not accustomed to Ebola in West Africa, so it took us by surprise.
An emergency operations center has been activated in Lagos with the National Centers for Disease Control of the Federal Ministry of Health.
We are not going to give up. When I remember Dr. Sufi's water run away me,
our health workers were on strike. It's very doctors. There was panic, there was fear. This is what I think we needed to contend with.
During Ebola crisis, the greatest challenge we had was our capacity to test. We had to take samples and send out of the country, and it took 2, 3, or 4 days sometimes before we could get a result.
We experienced a significant amount of deficiencies. It exposed our weaknesses.
Our hospital, being the center for treatment of infectious diseases, was where the patients were brought in. Because of the contact tracing and the rest that were very effective, the disease couldn't spread beyond the few numbers that it affected in the country.
That's the nature of emerging infectious diseases. They'll pop up out of nowhere. Sometimes we know what it is, sometimes we have no idea, which begs the situation where we need the science capability to be able to rapidly detect what it is that is emerging to threaten the security of our communities.
After we finished Ebola, we felt there was a need to have a laboratory where you can detect organisms of high consequence.
We are also preparing for pathogen X, an unknown pathogen that we have never come in contact with. So we need a lab that is well equipped to be able to diagnose.
GET has been a technical partner for the Lagos State Ministry of Health on biosecurity and biosafety. They have worked in collaboration with Lagos State Ministry of Health since immediately after the Ebola incident in West Africa between 2014 and 2016.
This lab is a counterpart initiative between GPP Canada and Lagos State government. What you are seeing is the tip of the iceberg. This is only one of its kind in West Africa as of today.
A pathogen of high consequence is not a pathogen that's managed in an ordinary laboratory. There are different levels of security and biosafety. And what we see in ordinary hospitals and medical facilities are usually 1 and 2, where you manage every day-to-day infections. But when you start dealing with dangerous pathogens, you move into category 3 or 4.
We've been undergoing training for the past 3 years on biosecurity, biosafety, good laboratory practices within and outside Nigeria.
Immediately, we got news about the outbreak from China. My commissioner for health, who also happens to be an expert in biosecurity, said to me then that, Mr. Governor, there's a tsunami coming.
We've always been expecting this scenario. It wasn't a case of if, it was a case of when. And when has happened.
Attending to any patient at all, you must do the needful in terms of protection.
Train our doctors and let them know what to look for is very, very critical.
Educate the facility on the need for proper waste management and waste sorting.
we raised our level of concern from Emergency Operations Center to Incident Command System, and we did that for a reason, because we were watching what was happening globally, and we recognized that if we got an index case in Lagos, we would soon be in a very difficult situation.
With immediate effect, I will take charge as the Chief Incident Commander, and the Honorable Commissioner for Health will be the Deputy Incident Commander.
We have buckets of levels of preparation that we've done. From we having an incident team to we actually physically having set up of infrastructure, and to we also building up layers of communication. Given our experience from Ebola, which was about 6 years ago, we need to go back to that facility and wrap up the capacity of that facility very, very quick. So we started.
We maintain, we manage, we operate public infrastructure. How are you? Michelle. We were called in to come to this Yaba IDH in January. The governor wanted 100 beds in like 2 weeks.
So I'm going to take you from where the entrance is, and I'll walk you. Honorable Mr. Good morning. Thank you very much for coming.
If there's any good that has come out of this COVID, is the strengthening that the health system is getting out of it. I know the number of beds we've had to buy. I know the number of ventilators that we've had to buy or we've been given.
So this is where the ICU is located. So some construction work is still ongoing, but we have a number of ventilators.
It is not all patients with COVID-19 infection that will end up in the critical care units. A small percentage may end up with such difficulties. And Lagos State on its part is making sure that we set up a befitting critical care unit for this isolation center in this place.
A lot of lessons from the Ebola outbreak of 2014. So I'm confident that Lagos is ready. They have the highest volume of air travel. So the preparedness here is more important than anywhere else.
We've been able to establish quite significant infrastructure and capacity here in Lagos.
The Lagos State government has put in a lot of money into infrastructure, commodities. We're getting some support from the private sector.
Lagos being the epicenter, we got the Yaba site to do the first isolation center that COVID is building.
So this is a large expanse of land that was recently cleared, and it is meant to house a tent. You can see people doing some measurement there.
COVID is a coalition of private sector partners to bring our support, our resources in the fight against COVID-19.
So they're working on the first floor now. By tomorrow morning they'll be done.
So all your oxygen will be here?
Ventilators, everything will be.
Perfect. So I don't want us to stretch ourselves in too many directions. Leave this tent here. We'll come back to it if we need it. Concentrate on the tent at Yaba and the permanent site at Yaba. It's important to get it right because it's going to be the template that will be used across Nigeria.
No nation on the face of the earth was prepared for this. Even the ones who had better healthcare system than we do, they're not prepared for it. But I know one thing for sure, Lagos is preparing every day.
A lot of holding centers, there are a lot of isolation centers, both temporary and repurposed structures.
So everybody comes this way. Doctors, nurses, hygienists. Where's your kitchen?
Kitchen will be outside.
And then we're going to create some accommodation for staff.
The role of training is the most important part of preparation. So the Lagos State government has been proactive. We've had a long list of volunteers.
While you are talking of detergent, same thing goes for bar. Or no, I must use bar soap. Why? Where you place your bar soap is already a good medium for microbes to thrive.
The information I've gotten is actually quite voluminous, and it will go a long way, not just for me, but for the grand populace and even my friends, my family members, and everybody I interact with. I'm not disputing the fact that I'm afraid for my life. I'm not disputing the fact that the mortality rate is high. But if every single one of us decides to function out of fear, nothing will be done. But that courage to face the fear, to conquer the fear, it's what drives me to volunteer.
You're not going to put soldiers in a war without training them. You will arm them, you will train them, and then sometimes they may be used to a certain kind of weapon. But if you're giving them a new kind of weapon, then you have to show them how to dismantle it, how to put it together, how to fire it.
I'm very happy to see you.
Thank you, sir.
At last, I have the manpower. Now I need the equipment.
Yeah.
Then we need the SOPs.
Yes.
Then we need the science. Okay, I hope you are following the discussion around ventilating COVID patients.
You know, you cannot just wrap up and build 1,000 bed spaces overnight. So we started and said, okay, from experience, make sure we can do at least a 50, 100, a 150, and begin to scale it up.
We have so many beds at Yaba that are not bad. Biomedical need to look at them. We have all our biomedical engineers. It wasn't difficult for an infected person to get on an aeroplane and fly to another country, and that indeed happened. And someone flew into Lagos and started the epicenter in Lagos, or what we described the Nigeria Index case.
This is part of the first 2 wards that we did, the first 2 sets of 100 beds that we did. This is the male ward in front and the female ward in the back. This male ward is where the first index patient is isolated.
We've started the contact tracing process with the index case. We will be reaching out to every member, every passenger on that flight.
So it's like trying to find the last person that could possibly have been exposed.
We continue to scale up our level of preparedness. There's no school that has given you a peep into what level of preparedness you need to have. You can never be over-prepared. Like the saying goes, prepare for the worst, expect the best.
We're not declaring an emergency in any form. We just have an heightened state concern on the coronavirus.
Hello, welcome to the Lagos State COVID-19 call center. How may I help you?
Please, ma'am, my brother is very sick. He has fever, he can't breathe where he's COVID, ma'am.
Please calm down, madam. May I know your name and where you're calling from?
My name is Grace. I'm calling from number 12 Ajayi Street, Ajayi Tiosa local government.
Okay. Any sign of sore throat?
Yes, yes.
Tiredness?
Yes, ma'am.
Headache?
Yes, yes.
Loss
Yes.
of taste or smell?
Yes.
So, where are you? Are you in your home?
Yes, we are in the house, ma. We are to.
Where exactly? Parlor, room?
We are inside the room, ma.
Okay. Please calm down. Lock the door. Let no one in. Someone from the Lagos State COVID-19 response team will call you shortly.
Thank you very much. Thank you. Okay, ma.
Please keep your phone handy.
Okay, thank you, ma.
It's not an ordinary test you can do anywhere.
No, coronavirus doesn't exist.
I don't take it serious any longer.
They feel there is no coronavirus, they go about and do whatever they like.